This next video is going to give you a tour of the aorta of two different ages. 22 years old here, stained with H&E, an elastic fiber stain or elastic tissue stain, and a 7-year-old individual showing what the aorta looks like in that age compared with H&E compared to elastic tissue stain. So first of all, the 22-year-old. This would be like an adult. And when you look at the aorta, again, this is a 3-layered hollow organ. And throughout the cardiovascular system, all the blood vessels, the 3 layers are enema. That's what the I stands for there. And the media, that's what the M stands for. And adventitia, that's what the A stands for. Now, the enema is composed of a layer of, and it depends on where you go along here, you may see a better representation of it. The endothelium is kind of torn off here. And I'm going to pause this, see if I can find a better example. Okay, so here, these flat cells constitute the endothelium. It's just one cell layer thick, and it's composed, the tissue is simple squamous epithelial tissue. And then you've got a connective tissue that kind of resembles loose connective tissue, the rest of the enema, and then you have the first elastic membrane. Now these elastic membranes, they're really hard to distinguish a single membrane because they've been a lot of tension over 22 years has been imposed upon the elastic membranes, and so you have fibroblasts and mainly smooth muscle cells that are connected from one membrane to the other, and as the heart beats and the aorta expands and contracts, elasticity to keep the blood flow running fairly smooth with pressures not dropping to 0 but ranging between 80 and 120 in the arteries. There's a lot of wear and tear on those elastic membranes, and that's what you're seeing here. When we go and look at the outside, the adventitia is composed of collagen fibers and fibroblasts, and it makes a constrictive cuff around the aorta so that it's contained. Now, the one thing that can happen, if this collagen is defective, then you can get an aneurysm, and so these elastic membranes can start expanding and blooming out here, and if that bursts, then it can be fatal unless it's caught in time. Okay, so let's go now to the elastic tissue stain of the aorta. And we look at the same layers. You see where most of the black staining is in the media, and that's where the elastic membranes are. And now you can make out the membranes, but they're still, shall we say, not smooth. They have holes in here that the nutrition coming from vasa vasorum, vessels out here, percolating nutritions through, and even absorbing from the lumen of the aorta. This first elastic membrane down here is fairly complete, but the rest of them show a lot of, I'm not sure the correct term is wear and tear, but there are all these cells in here, a lot of them are smooth muscle cells that are connected between one membrane and the other and provide a tension for a threshold for stretch. Okay, so now we're going to go to the 7-year-old stained with H&E, and you're going to see a big difference here. Again, the 3 layers are recognized. I haven't labeled those, but the enema with the endothelium is right here. It's very thin. And then you have all these membranes. You can begin to see the individual membranes with the fibroblast and smooth muscle lying between. And that out here is the adventitia. But the real dramatic presentation is in the elastic tissue stain of the aorta. And here now you can see the individual membranes that are fairly smooth and have not been stretched or, let's say, fragmented like they were when you saw the 22-year-old aorta. So study these specimens and think about the implications and the histology of the aorta, which is a part also classified as a large artery. and also known as elastic arteries. And these would include the aorta, the first part of the carotid arteries, and the femoral arteries, and some of the branches, the main branches off the aorta in the abdominal cavity. Okay, so we're going to stop this now and go on to the next.